Victory Studios in downtown Little Rock, this is Capitol View.
And good Sunday morning to you. Welcome into Capitol View. I'm Jay Burr. Well, State Senator Jason Rapert has been recently discharged from the hospital after fighting COVID-19 and pneumonia. He's actually joining us here today to give us just a little bit of insight into what that actually looked like. And State Senator, we are glad that you're here with us. We're glad you're out of the hospital. How are you feeling right now?
Well, I appreciate you for reaching out to me, and this literally is the first day that I've been told that I have a completely improved x-ray of my lungs. I just returned from my physician this afternoon. It's been quite an ordeal, so I do feel better. I apologize. There's a little noise outside of here where I'm at, but hopefully we can get through it. If not, you can come back and do something here in a moment.
Well, that's no worries there. We'll power through it here, but we certainly do appreciate you joining us here, especially first day afterwards here. I guess just first things first here, do you know exactly how you contracted the virus or maybe even where you may have got it?
No, I don't, and I do have a lot to say on this. I thought about this today, Jay, when you reached out. My family lost my mother-in-law at the very beginning of this pandemic, just when they were shutting hospitals down. My mother-in-law succumbed to illness and passed away at the Baptist Hospital under some of the very first restrictions that they had with the COVID-19. And that was the environment in which my family was introduced as we tried to love for my mother-in-law and her laying there dying in a hospital and many of us not even being able to be with her like we wanted to. And that's what my memory is of what happened in March. And of course, in our state and every state across the country, we begin to grapple with what we're dealing with here. This is an illness that's nobody's fault. And I have seen people politicize this thing, Jay, in such a way that it's very offensive to me. And it's very offensive to the people that are struggling with it and to the healthcare officials. And so we've all been grappling with this. And obviously, I have used masks, urged people to use common sense. And we've done this at the Capitol. The governor's been urging common sense. And it's simply a situation where I don't know exactly where I contracted it. I was social distancing from people, have been for months and months. Did I pick it up at a gas station? Did I pick it up when I stopped through a drive-through? I really don't know. But the fact of the matter, it doesn't. In the end, we're all doing what we can to try to distance and hand wash and do all the right things. And then just people get sick. And so what happened with me specifically on this is that on July the 17th, I came down with fever. And I immediately self-isolated away from all of my family. Fortunately, I had a house structure that I could get away from to just be away from them. The very next day, I was tested at the Baptist Hospital in Conway, Arkansas. They swabbed me. I was in fever then, of course. I continued to stay away. I had driven myself to the hospital. I then came back and I lay for 6 days with fever. And I was given a call on the 21st of July and told that I had a negative test. So the first swab was actually negative for me. I was sick, so my physician brought me in an isolated room, took a picture, and said that I had pervasive pneumonia throughout my lungs and that I definitely had walking pneumonia and needed to begin to treat immediately. And he said, if you do worsen, you're going to need to go to the hospital. Well, unfortunately, by the 22nd, obviously, I was worse. And I did go into the hospital at Conway Regional. They did what is called a rapid test. That rapid test came back positive for me. They immediately then took measures to break my fever, and that's what began to turn me around. And so my written records right now show that they broke my fever on the 22nd, thankfully. And from there, then I began to improve. I will say this. I am very grateful to the doctors and the nurses in the care. And I feel for them because they are under a lot of stress and the confusion that we're all seeing out here in the public. They're under just as much stress within the hospital setting. For instance, when I found out what I'm dealing with, they told me, they said, Senator, it's like Velcro in your lungs. These sacs inside of your lungs are freezing up. It's not productive like a normal pneumonia, and you're going to need to stretch and try to get your lungs to open. They said as much as you will talk, as much as you will use this breathing exercise, it will help you survive this. So I embraced that. And they told me, they said, you get up and move around as much as you need to. I was in a negative environment room. There was a hole cut in the wall in the hospital room with this. They said it sounds like a jet engine. They offered me earplugs because it's sucking all of this negative air out of the environment to keep that air out of the rest of the COVID wing. And so I embraced what they told me to do. And I used the breathing apparatus. I would get up, I would breathe, and I would force myself, even though it would hurt. And that really, they told me, they said, you're one of the best patients we've got. You're trying in here. And so I was doing that. But I want to say all of this to you, Jay, and I'm sorry the noise that I've had out here. The fact is that I immediately asked for hydroxychloroquine and the budesonide inhaler that was a nebulizer that you've heard talked about. Mm-hmm. I was shocked to find out that I was told that even though my friends who had improved and been given hydroxychloroquine, they said that they were not allowed to give it to me. Now here I am. I'm one of your elected state senators being told I can't have hydroxychloroquine. Now, it's not the fault of the people that delivered that message to me. It's the fault of the health authorities that give them the idea somehow that they couldn't use a drug that is used on people every day with lupus all over the world and has been saving lives in other countries.
Well, let me jump in real quick, State Senator. I don't mean to cut you off here, but Dr. Jose Romero has actually testified before that, he doesn't necessarily agree that the hydroxychloroquine has been a sort of a magic drug, if you will, or been that effective in a lot of cases. Now, he says there are some cases where people have responded to it, but widespread, he hasn't seen that himself. I mean, what would you say to that?
Dr. Romero just said those comments today. I saw them. I've had conversations with Dr. Romero. I'll speak about that in a minute. And I will tell you that I'm offended at the mishandling around the country, because there are countries where people are not dying because the prophylactic effect of hydroxychloroquine is working for them. I've led 8 teams, Jay, to Ghana, West Africa, taking malaria medications with those teams. And it's the same class of drugs. There's something very wrong, because here's what I was told. They said, we can't give you hydroxychloroquine, but we will give you resmetiviir. This is the $3,000 to $3,500 per bag drug. And I was put on it for 5 days. Now, let me say this, and I want to hopefully you don't edit out my comments. And that is that I am extremely grateful for my care under the circumstances. And they're doing exactly what they said they've had to do. So I am proud for that, and I'm thankful for that. But there's something wrong when doctors know hydroxychloroquine would work, but they're forcing people to take medications that's $3,000 a bag, 5 days on it, on top of the fact that I was nearly 6 days in the hospital. And so there's something wrong, and I've pledged to come out of this to do my level best to make sure that patients' rights in our state are upheld in a way they never have been before. We should not be allowing people to get this sick and have to go in and have extra things done for them in hospitals as we've had to do. Now, I will say this again, you have to understand, as I lay in that hospital, I prayed with the doctors and the folks that come in the room, because they're under such stress. And we had people in there on ventilators and floors below me. And I spent my time praying for those people. And I was told that some of those people were coming around, thank God. I'm just telling you, Jay, having gone through this now, it's obvious to me the bungling and the misinformation is frustrating doctors. It's frustrating physicians. It's frustrating consumers. And it really seems to be out of control. And I fear it has been politicized in many ways. One other aspect, I'll keep talking till you stop me, I guess.
well, let me ask you this though, because I know you've been active on your Twitter and your Facebook, and you've had some interesting comments when it came to this. I know a lot of people look at you as a polarizing fellow, but what are some of those things that you've seen? I know you've gotten some good, you've also gotten some bad too.
Well, let me tell you something. I believe in speaking the truth, even if the ground shakes. That's not polarizing to many people. That's refreshing to some. It's only polarizing. I found that people only hate you when they hate the truth. And so I'm going to speak the truth. So I will tell you something I did not expect and has renewed my vigor is that as I lay in the hospital and I begin to get messages from liberal activists wishing that I would die in the hospital. This is recorded because there are voicemails on my Facebook page that I've shared because people are really tired of the vitriol and the hatred that's been poured out in this country that's driving this nation apart and bringing us to the point where we can't even live together. And I've experienced this even in the midst of this. People didn't know if I was on a ventilator or if I was near death, and they're sending messages saying it would be a dividend for Jason Rapert to die, even going so far as to send pictures of my family, Jay, with terrible, intimidating messages referencing my family. And a woman, even on the voicemail, you can go listen on my Facebook page. She said, I hope your whole GD family dies. This is wrong. I'm not going to have an America or an Arkansas where people live under that kind of language coming out of people. Common decency has to be spoken up for. And so, yes, I rebuked that strongly, and I'm going to continue to do that. I guess, when they tell you they want you to die, that got me up off of my bed in there, because I'm not giving this country over to the kind of evil that I see coming out of the left. It's wrong, and every leader in this state and this nation should stand against it and stop letting these people ravage innocent folks in our country with this kind of hateful rhetoric.
Well, State Senator, we surely do appreciate the time. We are glad that you're doing better, and we will do it again soon, boss.
I hope we will, because there's a whole lot more to say about it, as a matter of fact.
Absolutely, and we will definitely let you back on in when that time comes around. Jason Rapert, we certainly do appreciate it. Well, they've been tasked with spending $1.25 billion. Coming up, we talk to the chair of the CARES Act Steering Committee about how funds are being allocated across the state. You're watching Capitol View on Sunday morning.